All these agencies are human service agencies. We want to do the best we can for the folks we serve, for our community.
For us, it's really important that we're able to show up as our best selves at work, and that's hard to do if you're carrying bricks on your shoulders. There's been a lot of heartache, a lot of lack, poverty, overdose, and things like that. And so it's very difficult sometimes to feel healed when you're working in a community that needs so much healing.
In the spaces that we're in, I do think a lot of it is the impact of the work. I mean, people are really struggling. Most of those disciplines really don't have training about what trauma really does to people, to your brain, and then how to manage all of that. If they're not supported, I think they don't stay very long.
We feel like we've done a lot, but our agency has also been through a lot. Had staff turnovers, we've had funding ups and downs, all kinds of things we've had to deal with.
Being a healing-centered organization is a very reciprocal process. From an employee perspective, an organization that invests in you, you are more driven to invest in them, invest in their vision, and see the bigger picture and the long-term vision that they want to take down the road. Recognizing that was an opportunity for us to do some true reflection on our own organization. There is no cookie cutter approach, so be patient, understanding that it's going to take some time to get full organizational buy-in and continue to bring it up and find your champions. That is one of the biggest things, is find your champions within your organization who also see the value added. Be patient and find your champions.
In public health, like in a lot of other things, you need data. They're always asking you to do your policies, your procedures, your plans and things based on what the data says. And this helps us have some data. It helped us see what's going on with folks, just where they are. Even the process of getting people to participate was a whole experience.
There has to be buy-in and there has to be trust when we're talking about things like workplace trauma or community trauma, or even things that might show up at home that then spill over into your day-to-day. Trust has been crucial for this.
It was really eye-opening for us to go through it and realize the areas that we did need to make some changes in.
We're listening to them and we're being involved in communicating with them. We are helping them be a part of the change.
I think this assessment is going to benefit our organization, and that it gives us an opportunity to really look at not just where we are, but give us a path forward to build on all the work that we've done over the years.
This has benefited our organization by providing our team with the tools and the strategies to implement these principles so that we are treating our clients in the way that they should be treated.
You know, it might feel funny to you to incorporate arts, to incorporate what we call manipulatives, like little sensory items and things during staff meetings and during other events. You know, you may not quite get it, but the data says that they do, and they want it and they want more of that. It was also a way to kind of build camaraderie too. We have teams now that work so closely together that there are times where it's like a running joke, you know, which department you're actually in, who you actually work for. And that wasn't the case before.
Do it. My suggestion to folks, you know, would be that they should make the time for it and the space for it. That there's a lot of value to it, and while it may seem daunting, I think folks will find that they're probably doing a lot of things right, and there's probably just small things that they need to do to be more trauma informed and reach our folks in a manner that's better for them. So it's not necessarily going to be a huge undertaking. It's worth it.
Every organization, big and small, needs to do this because we need to be more healing centered. The world needs that right now. Every community needs that. Every family, no matter how you define family, needs to be more healing centered right now.